Good morning. I'm Vanitha from Shree Venkateshwara College of Physiotherapy, Tamil Nadu, India. Before entering into my presentation, I would like to thank Inti International University, Malaysia for giving this wonderful opportunity in this forum. Thank you. My topic is efficacy of metabolic resistance circuit training on APOB level to prevent cardiovascular risk among hypertensive obese young adults. First, let us see about the risk factors of the topic. That is main is hypertension. This hypertension, a major modifiable risk factor for cardiovascular disease, is increasingly prevalent among young adults, a trend once thought to be confined to older population. Often silent and asymptomatic, this hypertension is significantly increasing the risk of myocardial infarction, stroke, and renal disease. Studies reports that in India, nearly 16% of adults suffer from hypertension, with growing prevalence among youth due to lifestyle transition, poor diet, physical inactivity, and increased stress. Young individuals are at higher risk due to early exposure to modifiable risk factors. Obesity, excessive salt intake, sedentary behavior, substance abuse, and chronic psychological stress are the main key contributors. Pathophysiologically, hypertension in young obese adults is linked to increased sympathetic activity, endothelial functions, renin-angiotensin aldosterone system activation, and vascular remodeling. Obesity compounds this by increasing insulin resistance and pro-inflammatory cytokines, promoting arterial sclerosis and oxidative stress. In this, one of the major biomarker which is gaining the attention is apolipoprotein B, which is a structural protein showing the integral to all atherogenic lipoproteins such as LDL, VLDL, and IDL. Unlike LDL cholesterol concentration, APOB directly reflects the number of atherogenic particles. Elevated APOB levels are strongly correlated with the development of atherosclerosis and are more accurately predictor of cardiovascular risk than traditional lipid measures. Moreover, emerging evidence suggests that APOB levels are predictive of hypertension independent of body fat and insulin sensitivity. Given this, effective strategy to reduce APOB could contribute significantly in the early prevention of cardiovascular disease. Non-pharmacological management of hypertension, especially lifestyle modification, is considered to be the first-line treatment. Among these, exercise intervention have proven highly effective. Aerobic training, dynamic resistance exercise, isometric training, and combined metabolic resistance circuit training. All this helps in the reduction of both systolic and diastolic blood pressures and the major vital biomarkers. This metabolic resistance circuit training is characterized by high intensity, short rest circuit-based workout that targets multiple muscle groups in particularly promising. It's not only improves the muscular strength and endurance, but also includes significant cardiometabolic benefits, including enhancing the insulin sensitivity, reducing the fat mass, and improving the lipid profile. Preliminary evidence indicates that this metabolic resistance circuit training may effectively reduce the APOB level and improve cardiovascular health markers in obese population. Hence, the present work of the study is to evaluate the effect of metabolic resistance circuit training on APOB level and thereby to prevent the cardiovascular disease among young obese adults. Moving to the aim of the study is to find out the effect of metabolic resistance circuit training, introducing the serum APOB level and preventing cardiovascular risk in hypertensive and obese adults. The objective of the study is to evaluate the effect of metabolic resistance circuit training on APOB level in hypertensive obese young adults. The next is to evaluate the metabolic resistance circuit training on cardiovascular risk in hypertensive obese young adults. Now moving to the hypothesis, Null hypothesis, there is no significant impact on metabolic resistance circuit training exercise on APOB level and prevention of cardiovascular risk among hypertensive obese young adults. Moving to alternate hypothesis, there is significant impact on metabolic resistance circuit training on APOB level and prevention of cardiovascular risk among hypertensive obese young adults. Now moving to the methodology, my study design, it is a pre-experimental single group pre-post study. The study population is hypertensive obese young adults. Study setting, it is the Department of General Medicine done in KMCH Specialty Hospital, Erode, Tamil Nadu. And sampling technique is convenient sampling technique and sample size is 15 subjects and study duration is the period of 6 months with 12 weeks of treatment duration. Moving to the selection criteria, the inclusion criteria, here I have included the age group between 18 to 28 years of both genders and BMI greater than 30 kg per meter square and the BP, the systolic blood pressure, the 130 to 150 mmHg and diastolic blood pressure greater than 90 mmHg and persons who are physically active. Moving to exclusion criteria, chronic heart disease, musculoskeletal injuries, participant with neurological disorders, dyspnea, chronic smokers, all have been excluded. Next, moving to the variables. Independent variables is metabolic resistance circuit training. Dependent variables is two. One is serum apolipoprotein level. The next is cardiovascular risk. Group allocation is a single group with a number of 15 who's going under metabolic resistance circuit training. The outcome is just to see to reduce the serum apoprotein level and next is to prevent cardiovascular risk. The outcome measures used here is serum APOB test for check whether the serum apoprotein level has been reduced or increased. And next for the cardiovascular risk I have used ASCVD risk score. And moving to the statistics tool, PAT or dependent t-test. Now moving to the exercise intervention, here the metabolic resistance circuit training is being used, which is done for 45 minutes thrice a week, followed by warm-up 5 minutes. The warm-ups that is done is low intensity exercise like march on spot, heel dips and knee lifts. And after the ending of the session, cool-up down period is used for 5 minutes. In this, the exercise phase consists of 35 minutes but 45 seconds of workout followed by 15 seconds of rest period. And exercise intervention, this is for 12 weeks has been done and the exercise, it varies, the techniques varies for each group. Whether week first I have given adaptation and techniques and the third and fourth week I have concentrated on the foundation and building and the fifth and sixth week I have concentrated on the progressive low overloads and next 7th and 8th I increase the volume and intensity and in the 9th and 10th week stability and the core has been emphasized and in the 11th and 12th week the peak conditioning has been done. And these are the exercise. For the lower body I have chosen squats and for the upper and the chest I have done push-ups, then deadlifts, bent over rows, walking, etc. These are my exercise which has been followed as a circuit training. And these are the demographical analysis. And this is my data analysis. And the graph has been denoted down. Now moving to my result. The result, it focuses on the efficacy of metabolic resistance circuit training on lowering the apoprotein level B and estimated atherosclerotic cardiovascular disease, that is ASCVD. 10 years risk score has been used, a paired sample t-test which was performed on pre and post intervention data from 15 young obese adults. First, let's see about the APOB level. The mean of APOB concentrates before the intervention was 122.27 plus or minus 4.56 mg per deciliter, which significantly has been reduced to 109.33 plus 4 or minus 4.91 milligram per deciliter following the metabolic resistance circuit training program. The differences in mean was 12.93 mg per deciliter, indicating a marked reduction. The PROF test revealed these differences to be statistically significant, which is 62.71, which suggests that the robust impact of metabolic resistance circuit training on APOB level. Now moving to the ASCVD 10 years score. Here the mean score has been decreased 5.41 plus or minus 0.49 percentage as a pre-intervention to 4.57 plus or minus 0.50 percentage post-intervention. The mean differences of 0.84 percentage was statistically significant, which indicates that PROF test results 32.29. This supports the conclusion that metabolic resistance circuit training may effectively lower the long-term cardiovascular risk in the population. Moving to the discussion, the present study aims to evaluate the efficacy of metabolic resistance circuit training in reducing APOB level, thereby mitigating cardiovascular risk in young obese adults. The findings demonstrated a significant reduction in APOB level on post-intervention, suggesting the potential role of metabolic resistance circuit training as a non-pharmacological strategy to improve cardiovascular health in these populations. APOB, the primary apolipoprotein of atherogenic lipoproteins such as LDL, IDL, serves as a robust marker for atherosclerotic cardiovascular disease. Elevated APOB level reflects the number of atherogenic particles, providing a more accurate predictor of cardiovascular events than LDL-C alone. The current study, metabolic resistance circuit training, includes favorable alterations in APOB concentration, highlighting its importance as a therapeutic target for early cardiovascular risk modifications. Metabolic resistance circuit training combines short rest intervals, moderate to high intensity resistant exercise, and circuit style programming to reduce both aerobic and anaerobic adaptation, that is including both aerobic and anaerobic adaptations. Approaches has been previously reported to enhance insulin sensitivity and to reduce body fat and improve the lipid profiles in obese and pre-diabetic populations. The current findings align with previous evidence, reinforcing that this metabolic resistance circuit training provides sufficient metabolic stress to improve lipid metabolism and reduce circulating APOB level. Furthermore, the significant reduction in APOB level may attribute to improved insulin resistance and central features of obesity and to contribute factors of dyslipidemia. Insulin resistance has been shown to impact APOB containing lipoprotein clearance and increase hepatic VLDL production. From a cardiovascular prevention perspective, the reduction of APOB level is clinically meaningful. According to the Inter-Heart study and resistant guidelines by the American College of Cardiology, elevated APOB is independently associated with myocardial infarction and atherosclerosis. Hence, early lifestyle-based interventions like metabolic resistance circuit training may provide a window of opportunity to prevent progression overall to overt cardiovascular disease in high-risk young adults. Moreover, the youth demographic presents a unique opportunity for early intervention. The increasing prevalence of obesity and metabolic syndrome in younger age group necessitates cost-effective accessibility intervention and long-term health impact. So this metabolic resistance circuit training is a feasible, minimal equipment requirement and time efficiency make it a suitable modality for implementing in this age groups. However, this study is not without limitations. The sample size was relatively small. The intervention and the duration was limited to 12 weeks. Longer studies are needed to assess the sustainability of the APOB level. Moving to the conclusions and limitations, I conclude the study. The conclusion of the study is that there is a high significant impact of metabolic resistance circuit training, which is an effective and practical intervention to reduce APOB level and by extension cardiovascular risk in younger obese adults. This finding supports the incorporation of metabolic resistance circuit training into preventive health programs targeting metabolic and cardiovascular disorders in youth. Limitations: variability in age, medication use, disease severity, comorbidities, and baseline fitness levels are confound outcomes. Therefore, further studies that include combined intervention with those with exercise alone to evaluate the potentials of exercise. Additionally, more variables should be measured, such as ethnicity of the population, lifestyle habits, pathological history, that can guide us to generate increasing strategies for hypertensive young patients. These are my references. Thank you.